Hello, my name is Kelly Page and I'm just addressing the points that I had missed in video 2. So beginning off with behaviour, so we assess our behaviour before heading towards the patient just so we can gauge how they might react to being handled and if we might need any restraints or any safety equipment like any muzzles. We also assess their level of consciousness, being are they dull, are they alert, using our terminology of are they bright, alert, responsive, or are they quiet, alert, responsive? Are they sedate? Are they unconscious? We also then look at their posture as well, which can indicate if they're in any kind of pain or distress at all. So if they're hunched over, if they're sat towards the back of the cage, or if they're nice and happy, excited at the front of the cage. We also then check our breathing and our respiratory patterns and effort as well prior to heading towards the animal, as once we do then head towards them, they can be aroused and that can change a little bit as well. So with that one, we're looking to see if there's any abnormalities, if they are tachypnea, which is increased breathing, which can be due to stress, heat, or pain. If they are bradypnea, which is a decrease in the respiratory rate, which can be to either them being asleep, them being in a sedate state, or due to medications as well. And then there also is dyspnea, which is the difficulty breathing, which can be seen in the rib cage, a lot of stomach moving as well, a lot of effort pushing up that rib cage and pushing it back down. They also can have a extended neck when they are struggling to breathe, and there can also be noises in that as well. So when approaching the patient, we want to make sure we've assessed all of this first. So when we are listening to the chest, we want to be listening to all of our 4 quarters of the lung lobes. So they are the cranial dorsal, the caudal dorsal, the cranial ventral, and the caudal ventral, which is, so dorsal is towards the back of the dog, the back surface, ventral is towards the middle, so underneath, and then we've got cranial, which is towards the head, and then caudal, which is towards the back end of the dog or towards the tail end. So we're checking those lung lobes for any crackling, any sounds, any wheezing. We don't want to be hearing anything that's abnormal or any popping as well. So I will demonstrate that now. So down here we've got our patient. So prior to assessing them, we are checking their posture, their behaviour. So we can see she's a bit quiet at the moment, so I would go with quiet, alert, responsive. So before approaching, we want to be assessing those breathing patterns as well, and then we can go ahead and do our lung assessment. So now doing our lung assessments, we've got our stethoscope here. So we're checking all of those quarters that I had mentioned. And then towards the caudal side and underneath as well. And we want to swap over to our other side and have a bit of a listen. Perfect, so those are all nice and clear. There's no extra effort in breathing, and there was no crackling or popping or any wheezing sounds in that exam. Next, we've got any abnormalities in our mucous membranes or our capillary refill time. So our normal colours is a nice pink colour. So if we don't want them to be tacky at all either, we want them to be nice and moist and not sticky. So if they are tacky or sticky at all, it can indicate any dehydration or shock as well. If they are pale, can indicate anemia, poor circulation or shock as well. If they are blue, it can indicate any respiratory disease or struggle with oxygen. So we do want to get that patient into oxygen as soon as we can and have a vet assessed as soon as we can as well. That can be a yellow colour as well, can indicate any liver disease, and any red gums can indicate any inflammation, some gingivitis sometimes, any dental disease. And with our capillary refill time as well, we want that to be less than 2 seconds. If it is higher than 2 seconds, it can indicate any heart failure, any shock, or any respiratory conditions as well. So the reason we check our heart rate and our pulse rate in sync is to make sure everything's okay, as a delay in our pulse rate to our heart rate can indicate any circulation issues. It can also indicate any issues with the heart and the function for it to circulate around the body. So if there are any delays, or if we've got a weak pulse on any of our pulse points, we do want to flag that with a vet right away. And then the last point I had, sorry, I've just got my notes here so I can see what I needed to address and fix up with the assessment, was what is the correct terminology for the hydration assessment. So this is the Skin Turgor test, which most people just tend to call the skin tent assessment. And then we've also got what's the need for keeping records. So the reasons that we do keep our records and write everything down is so if there are any issues in the future, we can go back and assess it. So others are also aware of what's happened and what the results are as well. So we have those on our cage cards that then goes further and gets written in our history as well. So if we ever need to go back and assess anything, or anything's abnormal in the future, we can check back and see if it was normal in the past or abnormal in the past and refer to that as well.